Let's look at also the lesson 3, whereby I shall be talking about the roles of the drugs in the spread of HIV. In this section, it aims at introducing you to drugs and substances abuse by giving their meaning, the classification, the mode of administrations, reason for using drugs, and the impact and their relationship with HIV and AIDS. Let's look at objectives. And objective number 1 is to explain the classification of drugs. So by the end of this, I should be able to explain the classification of drugs. The second objective is to explain the mode of administration of drugs, how this drug is being administered. The third one is to describe the impact of HIV and AIDS. So what is the impact of HIV and AIDS among the youths or in the community? Explain the relationship between the drugs and HIV and AIDS. What is that relationship between the drugs abuse or the drugs and HIV and AIDS? So let's define the drug. And we can say that a drug can be defined as any substance that affected the functions of living cell, used in medicine to diagnose, to cure the occurrence of diseases and disorders, and or prolong the life of patient with incurable conditions. After looking at the definitions, because we look at a drug, because it's a medication to administer, to cure, and so forth, let's classify the drugs. So in the classification of drugs, this talk about drug classification in many ways. You can classify a drug in the way they are dispensed, how the drugs can be dispensed. So either over the counter or by the prescription. So it is over the counter. You can go to the chemist today, buy the drugs, if it is being sold over the counter. But if it is by prescription, it must be prescribed by a qualified doctor. It can also be classified as the substances from which they are derived. So drug can be classified from, is it coming from the plants? Is it coming from the minerals? Is it coming from the animals? So this is the second classification of a drug. The drug also can be classified in the form they take. Because we know the drugs, we have the capsules, we have the liquid or the syrup, we also have the gas. So we can classify the drug in the form they take. Or we can classify the drug in the way of administration. When we talk about the administration of drugs, either by mouth, injection, inhalations, direct application to the skin, we talk about the absorption. So it can be classified in terms of administration. Also, it can be classified the way against or the way they act against this, the disease or disorder. For example, talk about the chemotherapeutic or chemotherapeutic drugs which attack specific organisms that causes a disease without harming the host. Or we can talk about the pharmacodynamics of a drug, which we talk about the alter the functions of the body system by stimulating or depressing normal cells activity in a given system. We can also classify a drug in its effect of a particular area of a body or a particular condition. Most common ways to categorize drugs, for example, we have the endocrine drugs, we have the anti-infection drugs, cardiovascular drugs, we have also a central nervous system drug, and we can also classify drug by their names, because all drugs, they do have 3 names. Either the chemical name, we have the the generic name or the brand name. So it can be classified in terms or classified in their names. Let's look at the mode of drugs administration. You know, the drug can be administered differently. Shall going to look at them one by one. So we are saying that the effect of drug on the body depends on a number of processes that the drugs undergoes as it moves through the body. All these processes together are known as the pharmacokinetics. These are from the early 1998. Literally, we talk about the motion of the drugs in our body. When we talk about the pharmacokinetics, is the motion of the drugs in our body. Administered orally, because drugs can be administered orally through the mouth, only drugs will not be destroyed by the digestive process of the stomach or intestine, can be given orally. So some drugs can be given or administered orally, so long as cannot be destroyed or deactivated by the GIT. We also have the drug which can be administered by injection into the veins, which assures the quick distribution through the bloodstream and rapid effect. Because when you have this kind of injection through the vein, the administration itself or the action will become fast compared when you take the tablets. Under the skin, into the tissues, which result in localized action at the particular site with the local anesthetics. So other drugs can be administered to the skin or under the skin. Others into the muscle. That is why we talk about the intermuscular drugs, which enable rapid absorption through the many blood vessels found in the muscles. Others can be intramuscular injection, may also be given as an depot preparation in which the drug is combined with other substances so as it is slowly released into the bloodstream. General anesthetics may be given through inhalation, because you know this kind of anesthetics you can inhale, and this is another way of a drug administration. Some drugs are administered through drugs-filled patches that stick to the skin. It can be patches can be stick to the skin, and that is another way of the drug administration. The other one is administered topically, that is applied directly to the skin. And you apply the drug to the skin, reluctantly absorbed through an enema or injection of the liquid into the rectum, or a rectal suppository. Talk about the pellets of a drug. There is another also way of medication that melts when inserted into the rectum. When taken together, drugs can interact with one another and produce undesirable or undesirable results. So here we are talking about the drug interaction. When you take the drugs, one drugs and take another, or when you take certain substances, what is the interaction in the body? And that is why you talk about it can bring desirable results, which is required, or undesirable results. Some drugs have an addictive or synergistic effect, that is, they increase the effect of the other drug. So when you take two drugs together, they could be having an effect whereby it can increase or it can be reduced. For instance, when you talk about the alcohol beverages, intensify the dosiness, producing effect of some sedative drugs. Drug also have a drug that is displaced or taken to the place of other drugs present in the blood proteins. Make the displaced drugs more active in the body, increasing their effect. Some drugs can also be displaced. When you take one drug, can displace the other drugs, making it maybe more effective, or it could be less effective. So you have to see in terms of the interaction of drugs. When one is given another one drug, they should know which drug act against the other drug, either positively or negatively. Other drugs have a reducing effect, that is, they interfere with the action of drugs already present in the body. For example, we have antacid, which prevent antibiotic from being absorbed by the stomach. So antacids is very good because it reduces the acid from their stomach. But when you take them together with antibiotics, the antibiotics will not work because it prevents that absorption by the stomach lining. Some drugs combine with other drugs to create a substance that has no medical benefit. So meaning they destroy the drugs or the active ingredient present in the drug. Some of the reasons for using drugs include, you can take drugs for example for pain relief and treatment, to control emotions, if you have anxiety and so forth. Other drugs can be used for relaxation, tension relief, boredom relief, increased sexual performance. Also you can take as a sedative, whereby if you have a problem of sleeping, you can take the drug, the sedative drugs, to increase the sleep. Now let's look at about the drug abuse. And you're saying that drug abuse is characterized by taking more than the recommended dose or the prescription drug, such as the depressants, without medical supervision, or using government-controlled substances such as the marijuana, the cocaine, heroin, or other illegal substances. Abusing illegal substances such as alcohol and nicotine. Abuse of drugs and other substances can lead to physical or psychological dependence. And that's why I talk about this, we talk about the drug abuse. You are taking more than what is recommended, or you might be taking less than the recommended. Or you are taking the drugs which are illegal substances. Let's look at the drugs abuse can cause a wide variety of adverse physical reaction. Long-term drugs use may damage the heart, liver, and the brain. So meaning that the dependency of the drugs, using the drug for quite a long time, it can cause the heart disease or the damage to the heart. It can damage the liver or the liver disease, or also the brain. Drug abusers may suffer from malnutrition if they are habitually forgot to eat, cannot afford to buy food, or food lacking the proper vitamins and minerals. Because these are drug abusers, they may not take keen in taking what kind of food, or talk about the balanced diet. So the high chances, or the probability of these drug addict is the malnutrition, because they are not taking proper care of what they consume. Individuals who abuses injectable drugs risk contracting infection such as hepatitis and HIV from contaminated needle shared with other infected abuser. So these are individuals, they have the risk of contracting the HIV, or it could be the hepatitis A, hepatitis B, hepatitis C, and so forth. One of the most dangerous effects of illegal drugs use is the potential for overdosing. A drug overdose may cause an individual to lose consciousness or to breathe inadequately. Without treatment, an individual may die. So without this overdose, they should be having the antidote. And if there is no antidote, that person definitely will die because of the overdose. Successful treatment methods vary and include psychological counseling, or the physiotherapy and detoxification programs, which are medically supervised, to gradually wean an individual from a drug over a period of a long of days or weeks. Detoxification and psychotherapy are often used together. Now let's look at the impact of these drugs. If you're taking the excess drugs, what will be the impact? You're taking the less drugs. What medication or the drugs, what will be the impact? So the first impact is the irresponsible behavior. A person becomes irresponsible all of a sudden because of taking these abuse drugs, either in excess or less. The other one is the mental illness. Another one is the addiction, because once you take the drug, you want this kind of continuing using them and then become addicted. There's also high chances of this school dropout, because now the person will lack focus, so they will not be able, maybe the need for going to school. There's high pregnancies in the community because of this, the impact of using the drugs. There's an increased crime. If the one is a dropout, not mentally stable, they can lead to the crime. Lack of social interaction, other could be abortion, the spread of HIV and STDs through the casual sex. Share needles, this another, the relationship between the drug use and HIV. What could be the relationship? Now we are talking about the drug abuse. We are talking about the HIV. What is this relationship or the link in between the relationship between the HIV and the drug abuse? And we are saying that shared needle syringe for use in drug application can carry HIV and hepatitis viruses. Infected blood drawn into the needle is injected along with the drug by the next user, and this can lead to the spread of HIV. So this using the drugs or using the needle or shared needle can lead to the passing over HIV from one infected person to another. Drug use is linked with unsafe sexual activity, because when one is taking this kind of drugs or is abusing the drug, it may not have the correct mental tool so that it can make a sound decision or practice a safe sex, and that can lead to this unsafe sexual activity. A lot of people believe that sex and drugs should go together. Drugs users might trade sex for drugs, and that will be true. Once maybe a person may not have the financial or they might not have money to buy the drugs. So what else? They go to the next alternative whereby they can trade the drugs with the sex. Other claims that sexual activity is more enjoyable when they are using drugs. Drugs are including the alcohol increase the chances of not using protection during sex, leading to the acquired immunodeficiency or this transmitting of HIV. A lot of drugs interferes with the proper functioning of these antiretroviral drugs or ARVs. So when you're using the drugs, it may lead to an interaction, either to increase or to lower the functioning of the drug. One who is a drug addict might forget to take his ARVs therapy, leading to the delay in the treatment and increment of the viral load. So you talk about the increase of the viral load. If you are not taking the ARVs as supposed to, the viral load will increase. And that you have high chances, or maybe the spread could be high. There may be overdose, which could be fatal. People with alcohol users disorder are more likely to contract HIV than the general population, as they are more likely to engage in behavior that place them at risk of contracting the HIV. Similarly, people with HIV are more likely to abuse alcohol in their lifetime. In person already infected, the combination of the heavy drinking and HIV has been associated with the increased medical and psychiatric complication in seeking treatment and poor HIV treatment. Heavy alcohol users have been correlated with a high risk of sexual behaviors, including the multiple sex behavior, unprotected sexual intercourse, sex with high-risk partners, because they may not have the proper mind to make the decision. Individual behavior, these are the assignments, number 3, whereby individual behavior change can drastically reduce the HIV prevalence. So you say, can you explain how these individuals' behavior can drastically reduce the HIV spread? The other one is define the term drug and describe how drug abuse may lead to high level of HIV infection. The other one is explain how social stigma has led to the spread of HIV and AIDS. And lastly, describe some of socioeconomic factors that have increased the vulnerability of individuals to HIV and AIDS. That is the end of lesson 3. Thank you. Shall we going to look at the last lesson, which is lesson number 4, where we talk about the youth and HIV and AIDS. Youth, sexuality and HIV and AIDS. So you say this session, it's aimed at introducing the youth, sexuality and HIV. In this section, it highlights the difference between sex and sexuality. It gives reason why focus is on the youth. These sections explain youth problems and challenges. And finally, this section gives factors leading to high incidence of premarital activities and hence HIV infections. Let's look at our objectives. First objective is that to explain HIV and AIDS among the youth. And also another objective is by the end of this, we'll be able to differentiate between sexuality and sex. And lastly, the reason why we focused on root, the reasons why we focused on youth. Also, look at describing the problems and challenges youth faced on sexuality and HIV and AIDS. Identify factors leading to high incidence of premarital activity and hence HIV infection. So those are our objectives that we need to achieve. So by the end of the lesson, we'll be able to answer those questions. Let's look at the definitions. The term youth, adolescence. So you're saying that the term youth, adolescents, this in quotes, and young people are defined variously. But by the WHO, it refers that 10 to 19 years, we talk about the adolescents, the age bracket between 10 to 19 years. That is talking of adolescents. But when you talk about the age between 10 to 24 years, they're talking about the youth. So the youth is he or she is in between the age of 10 to 24 years. 3 terms are often used interchangeably, whereby talk about youth constitute 30% of the world population. In the 21st centuries, we are talking about 1.7 billion. And in the year 2025, it will be 1.8 billion people. Size continue to grow across regions, countries, urban and rural areas. 80% of the youth, at least between the age of 10 to 24 years, live in less developed countries. And Sub-Saharan Africa has 194 million youth, that is comprising of 32% of the continent total population. However, there are variations in regions. When we talk about in Africa, we talk about that too, but they do have a variation. For instance, in West Africa, 32%, which is accounting for 37 million. In East Africa, we have 32%, which is accounting for 32%, which account for 75 million. In Kenya, we talk about this, look at from 2006, there were 12.2 million, or talk about 35% of Kenyan total population. But we are looking at the numbers is being projected to be around 18.3% by the year 2025. Remember, the census are out, and we're talking about the population of the youth in Kenya is also high. Kenya is among those countries with the highest number of youth people in Africa. Others include the Algeria, they have about 34%, Rwanda, the same, Zambia, and also as Switzerland. Let's look at HIV and youth. What is this HIV and youth? And you're saying that youth comprises an increasing percentage in new HIV infection, both in developing and developed countries. And that of these are young people between the age of 10 to 24 years. It is estimated that 6,000 youth get infected in a day, and 1 in every 14 seconds. Majority of them young women, as discussed by the UNAID in 2006. So meaning that all over the world, in one day, 6,000 youth get infected, and in every 1 in every 14 seconds, which is a quite huge number. Among 20 years and over, 60 million have been infected with HIV and AIDS, and half of them get infected between the age of 15 to 24. So when you look at the 15 to 24, we talk about the youth age. When you talk about 10 to 24, so it is in between the age bracket. So sex and sexuality. So this kind of mystery about the sex. When you are used to try to explain about sexuality or the gender, you use sex. And also when you are talking about the act of HIV, or talk about practicing sex, you use the sexuality. So here we are going to unpack what is sex and also sexuality. Sexuality has for a long time and is still a taboo subject, we know that, and many parents and religious communities fear if exposed to the youth will encourage promiscuity among them. For instance, resistance shown to the sexual offense bill of 2006, whereby they are trying to introduce the government trying to introduce sex education to school. These that are kind of people they are not willing to accept. All this is due to lack of understanding of what sexuality is. Sexuality has been confused with sexual activity. Sometimes talking about the sex when you are meaning sexual activity, or when you want when you want to talk about sexual activity, you are using sexuality or sex. So sexuality has been confused with sexual activity. Sometimes the term sex is used ambiguously to refer to a gender, that is a male and a female. And other times, sexual behavior or reproduction. Sex refers to biological attributes, characteristics of a person. So these are biological, which determines the person being a male or a female, that is sex. It is generally determined at the conception, whereby you can say the sex of this particular person is either a female or a male. It is often misused to mean sexuality, sexual activity or sexual behavior. When we look at the sexuality, it is a condition of having sex or sexual activity or interest, especially when it is excessive. It is a lifelong process of acquiring the information, forming attitudes, beliefs, and valuables about identity, relationship, and intimacy. So this sexuality, it is a long-term process. And like when we talk about sex, we mean that the gender, either male or female, which is determined at the time of conception. Why focus on youth? Why do we focus on youth? And one is sexual behavior is an important force in many people's life. So there are practical reasons for wanting to learn about it. Sexuality, with which information is held by all members of many African societies, they start out to talk about the curiosity, which continued lack of information has led them to seek it elsewhere. People or the community or the head of the family, they are not talking about these sexual behavior. And the youth themselves will find other ways, because out of curiosity, why is it not being talked about? So they look at other ways or elsewhere to find out what is this sexuality. And they can go as far as pornography, films, and so forth. Sexual experimentation. They'll go, they wanted to try about having this sexuality. So they have this kind of sexual experimentation. We also have early sexual activity, especially at the age of 6, lengthening of the time between biological readiness and marriage gap between 12 to 14 years. We also have some challenges. Young people present the greatest challenge for the prevention of new HIV infection. Safeguarding the health and well-being of a future generation and their potential parents. Young people, as hope of future, need to be major beneficiaries of efforts to prevent response to HIV. Youth are every nation's future. So when you talk about the youths, they are every nation's future. When there's no youth, there's no future. First, as an important resource whose capabilities must be tapped from development, for development. Because from the youth, you can be able to tap the capabilities, and that can spare the economy or the development. Secondly, talk about the major potential resources for economic development. Talk about the labor force and future leaders. So from the youth, you'll be able to get the laborers, you'll be able to get the future leaders. So between 10 and 25 years, youth form the bulk of the future human resource pool for any country. Prevention of HIV infection among youth could lead to the stem, or it could lead to the spread of pandemics. It could also reduce the amount of cost of treatment, providing resources that could meet other needs of the youth. It is the responsibility of everyone and the stakeholders to get involved in actual upbringing of the youth. Teachers, talk about the teachers and trainers, talk about the parent, family, our counselors, guardians, Youth are peer educators, counselors. These will have the right language. Youth have responsibility to seek appropriate information so that they cannot be misused, or they cannot find their way elsewhere if we're not going to provide the information they require. Let's look at also the youth problems and challenges that are faced by the youth. First one, we have the premarital sex. And you're seeing incidents of premarital sex have risen in the last decades. More people or more young people are engaging in sexual activities at early, or talk about early activities. Studies indicated that adolescents who had initiated early sexual activity, around 58.4%, were in an age bracket between 15 to 19 years. By 19 years, 97% of the adolescents had this experience. The effect of early initiation of sex is the substantial lengthening of the time between biological readiness and marriage. Also, that one is very important. And also you have that sexual experimentation. And we have factors which increases sexuality activities. The first one, we talk about the body changes. Remember, these people are growing up. They are youth. Their bodies are very active. New hormones is being produced. So these body changes, raising in the sex hormone levels, increased cultural emphasis on sex, rehearsal for adulthood, sex role, and all these four factors which increases this as a spread of HIV by the youths. Almost 60% have engaged in unprotected sex, means HIV infection, because there is no condom use. And if they are using condom, there is no talk about the correct use of condoms, or talk about the age of the sexual initiation is also lowering between the age of 8 to 10. Among those sexuality active include the secondary school girls. 6% initiate sexual activities at the age of 10 years. That is 6% by the age of 14 years. But for the boys or the boy child, 64% had sex by the age of 18 years. And 4% married by 18 years. The second one is the limited access to healthcare and services. Apart from this promiscuity or the promiscuous behavior, the second one is the limited access to healthcare and services. Healthcare and services are not available or accessible or affordable and accepted to the youth. They could be discriminating the youth, and that is why they are that limited, and it could be led to high these chances of HIV. Youth are marginalized in the following ways. One, this lack of resources, or not willing to access care due to HIV. There's no privacy. So thank God we have the youth centers whereby the youth can go check their HIV status. The other one is the denial. Talk about depressions because of the use of drug abuse and so forth. Not to focus on HIV until after the school. So one may not be able to focus much on HIV and AIDS, and also it could be a problem until they finish the school. That is why they go to real issues about HIV. But in between, one may be infected with HIV and AIDS. Another problem is inaccessibility of the services. The services will be there, but to access those services is a problem. The third one is the drug and substance abuse. Lack of calculations of risk of their behaviors due to the influence of their mind, because they will maybe not be able to calculate correctly how to practice safe sex or how to avoid this sex or to abstain. And Lack of inhibitions, hence high-risk sex. Promiscuity, rape, coerced sex is increased with the drug and alcohol use. Increased addictive psychotropic drugs, alcohol, abuse substances, hence increase the STD or STI, also the HIV and AIDS. Injecting drugs increases the HIV infection. The other problem is the abortion. Here we are concerned of unhygienic abortion because they can go to their quacks and they can practice that unsafe abortions. Also the use of unsafe instruments resulting to death. They can also lead to infertility, and it could also lead to chronic illness or ill health like HIV and AIDS in the process of doing the abortion. If that's not done by the qualified person, all these can lead to HIV and AIDS, or you can lose the person completely. Let's look at the other one is the adolescence, pregnancy, and childbearing. Pregnancy and HIV and AIDS are subsequence of sexual activity. Because if there is no sexual activity, there will be no pregnancy. And one may, there is no also HIV, even though we have other factors that can lead to one contracting the HIV. In the event, chances of a child being infected are high. Why high teenage pregnancy? This is the question of the premarital sex. If there is a premarital sex, there is high teenage pregnancies. Few condoms, hence high risk sex. If they know there's no use of condom, meaning that there's high risk sex. Many engage in premarital sex with lack of information. They just only enter into the act without prior knowledge, and that one also is a problem. The other one is an indication of vulnerability of HIV infection. People are more vulnerable if the immune system is low, and so many other factors. Also, you have sexual abuse and coercions, pressure and danger for the youth. Young girls are many because they exchange, or they may have that the coerced sex. Virgin treated for sexual assault. They also involve rapes, sexual assault, maybe for money, trafficking. We have the partners are violent. Force is usually characterized by pain, trauma, high chance of HIV and AIDS. So this kind of forced sex, there's high chances of one getting HIV, apart from pain and also the trauma. Female genital mutilations, so the FGM, I talk about 28% in Africa countries, as well as also the Kenya, among Muslims and so many other communities. Worldwide, we are talking about 80 to 110 of the Muslim undergoes cut in Africa and also the world. So if you take about 80, 110% is a very high number, and if they have not done properly, the high risk of this of contracting HIV. It is done between the age of 4 to 10 years, whereby one doesn't have that consent of doing an FGM, done by the native women without anesthetic and is unsanitary conditions. So if it is being done by these, talk about the native women, there's no anesthetic and there's no, the instrument they are using, they might not be sterilized, and maybe they could be sharing, and there is high chances of spread of HIV. So this kind of FGM, there are three types. You have the SUNA, you have the excisions whereby the clitorium or it is being completely removed. We have also infibulations, which is named the origin from the Egypt. Also, you do have the problem of this, the male circumcision. Traditional way of doing it should be discouraged, as it is predisposed one to HIV infection. So this old way of circumcising maybe the boy child, if one knife is being shared among all participants, there's high chances of HIV infection. If the other partners maybe could be sick, infected with HIV and AIDS. And the next one is the sexual education. It is a lifelong process of acquiring information about sexual behavior and forming attitudes, behavior, and values about identity, relationship, and the intimacy. It is about developing young people skills so that they make informed choice about their behavior and feel confidence and competence about acting on the choices. So giving them information so that they can make informed decision about the step to take in combating these HIV and AIDS. It is their right, but need help to protect themselves against abuse, exploitation, unintended pregnancies, STDs, and HIV and AIDS. Education seeks to reduce the risk of potentially a negative outcome from sexual behavior and enhance quality relationship by developing young people ability to make decisions over their entire infective. So also continuously subject covered by it include the physiological process of human reproduction, the working of the male and female sex organs, the origin, dissemination, and effect of venereal, family risk and structure, emotion and psychological sense, and sequence of sex marriage. Also, is look at the factors. What are these factors leading to high incidence of premarital activities and HIV infection in youths? The first one is talk about the lack of correct and inadequate information. Lack of information or this kind of misconception or refuse to negotiate about the safe sex. As all these misconceptions or the lack of information can lead to the high incidence of premarital activity and HIV infection among youths. Lack of information and knowledge on infections and transmission and control of HIV. If there's no lack of this information to know how the HIVs can be transmitted, can be infected, how can this can be transmitted, how can this can be controlled, the HIV prevalence rates or the incidence rates will remain high. We also have the culture or conspiracy of silence on sexual matters, especially maybe the parents, they don't want to talk about the sexuality with their kids or their children because they fear this kind of promiscuity. When one knows too much about sex, the high chances of practicing it. Little they know that it is the other way around. If they don't have the information, they'll practice anyway. So it is good to give them the right information at the right time. You also have sexual taboos, myth and silence around sex are all offshoots of traditional culture and religion beliefs, attitudes, and practices. Communication in this area is only through the eye, whereby there's no that kind of talk about the feelings, excitement, and movement. So there's not this kind of real talk about the sex or how to practice the safe sex or how to do it. So it is being controlled by also the feelings and the motive and also the use of the eyes. Also, you have the influence of the media, whereby they can get this information from the media, emotional changes, talk about the TV, talk about the video tapes, and so forth. It leads you to be curious and need to find out about sexual activity and intimacy from the media. And this, from the curious way, they'll be able to know anyway if the parent didn't want to talk about. You also have the myth surrounding the sexuality. And all those are the problems that the youth are facing. These are the assignment number 4, whereby you are required to highlight the differences between sex and sexuality, explain the reason why the focus on HIV is on the youth, and describe the problem and challenges youth face in relations with HIV and AIDS. Discuss factors leading to high incidence of premarital activity among the youths. All this you try to attempt from the lessons, and all the answers. If you take key of the lessons, you'll be able to answer all those questions. This is the end of lesson 4. Thank you, and stay safe.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.